So now let's talk about anterior knee pain. So anterior just means front, okay? So we're looking at the right knee here, right? So we're going to be talking about that pain that you get right in the front of the knee. Now, knee pain can be pretty tricky because it can blend quite a bit, right? Some people get pain here, but they also get pain here, or they get pain here and they also get pain here, right? But when we're talking about anterior knee pain, there's certain structures and certain kind of mechanics that we're looking at. So again, we'll take away the skin here. So let's just go over some of the structures that can be at fault for anterior knee pain. So we've got these two bursa here. Okay, so these are on top of the kneecap, right, and on top of your quad muscle tendon. So those bursa can get inflamed, right, with various activities. People who kneel a lot for work, right, maybe carpenters, painters, things like that, where you're kneeling and you're directly compressing those bursa, that could be something that's irritating it, right? So it doesn't have to be necessarily something you're doing while you're running. It could be something that you're doing throughout the day that just gets irritated when you're running, okay? So keep that in mind. Now, let's take a layer off there, okay? So in the front of the knee, we have this is your quad muscle, right? So this is your quad tendon here, which blends nicely with your patellar tendon here, okay? So two different structures that we kind of refer to as the same structure clinically usually. So this is your kneecap right underneath here, okay? So as we remove a layer or two, we need to remove the muscles there. Okay, so there we go. So your kneecap, again, like we said earlier in kind of our review, sits right in between two bones on the femur, right? So it needs to be able to slide and glide up and down like so. Now, you do have kind of fascial connections in through your IT band that do attach here, okay, to the outside of the kneecap. So when you have, a lot of tightness in through your IT band, that could actually be pulling that kneecap laterally out to the outside and causing it to kind of rub on the bone underneath. Now, vice versa, you can have the same thing happen on the inside of the knee with some attachments in through the hamstrings that actually come and have fascial connections in through that kneecap as well. Okay, so a lot of times when we're looking at anterior knee pain, we need to really be looking at the big picture, right? We need to see what's going on up at the hip joint, right? What's going on with the hamstring muscles and the quads, right? Because those have a huge influence on this guy right here. So usually when we're talking about knee pain, it's not the knee's fault, okay? It usually has something to do with muscular control up at the hip or something to do with kind of your biomechanics with your foot, right? So as the foot is planted and this shin bone rotates in when you're running, this knee is just going to follow that, okay? So we need to really be looking at what's going on with your foot mechanics and what's going on with your control up at the hip when we're assessing anterior knee pain. Now, with that said, let's go ahead and take off some of the muscles here, right? Take off some of the connective tissue, and let's just look at the bony anatomy one more time. So when we're talking about the front of the knee, if your pain is below your kneecap down through here, it's oftentimes a tendon, right? So it's usually that patellar tendon that we just took away. Similarly, if your pain is right above the kneecap, it's usually a tendon as well. It's usually the quad tendon. But most runners get pain right underneath the kneecap, okay? And like I said earlier, that usually has something to do with tracking, right? How is this kneecap tracking between this and this, okay, when you're running? So it's really, it's not as clear cut as we would like it to be, because there's really just a lot going on and there's a lot of different forces that influence the kneecap. But what you need to keep in mind is, if you are getting kind of that grinding, aching pain that feels like it's just under the kneecap, one thing you can do is you can start to just increase your cadence with running, okay? And we'll talk about this in a different section on how cadence influences joint forces at the knee and at the ankle, right? So a slower cadence is going to usually cause higher joint forces through the knee, whereas as you increase your cadence, that's usually going to cause increased stresses to the ankle, right? So people who are dealing with anterior knee pain, the first thing I tell them is to increase their cadence, right? And really just offload the pressure on this knee. In this next section, let's kind of go through and talk about certain exercises that we might try, certain stretches and things like that for those of you who are dealing with anterior knee pain.